Hello and welcome to this short video in which we cover some key principles for the assessment of practical and clinical skills using observed structured exams. The principles that we're going to cover here can apply to any form of assessment of practical or clinical skills, for example, workplace-based assessments, but we're going to consider them in the context of an examination in a controlled setting. The most widely known example of this is the OSCE, the Observed Structured Clinical Exam, used in health professions like medicine and nursing. This methodology, though, has been adapted for the assessment of practical skills in a variety of different disciplines. For example, in the laboratory setting, things like laboratory skills in STEM, or even things like teaching and management skills. This video is a basic introduction into how these sorts of exams are designed and administered, and it's aimed at anyone who is setting up these sorts of exams. It's also aimed at the learners who are going to be examined and assessed this way to help you get an understanding of how you're being assessed and why an examination is set up the way that it is. We'll use our fictitious University of Lobster as the setting for the video, and our fictitious university has fictitious departments in health, medicine, STEM, law, teaching, and more. Like I said, the way that we're going to approach this is that the basic design can be used to assess practical skills in any of these disciplines. We're going to consider this design in the context of effective assessment design principles, things like validity, reliability, authenticity, and so on. We've covered the detail of this in other videos, and we're going to apply them here for the design of an assessment to consider practical skills. We'll start with the concept of validity. This is the most important feature of the design of any type of assessment. Validity simply means, is the assessment going to measure what it is supposed to measure? It also means, are any decisions that are going to be taken with the information generated by the assessment going to be defensible? For example, does the assessment generate the appropriate type of information? Let's say if we're going to make a pass-fail decision about someone or decide whether they are safe and competent. We need to set the assessment up so that the information that it generates is appropriate for that type of decision. We'll stick with this competency decision because it is probably the most common use of information from these observed structured exams. Is a healthcare practitioner competent and safe, or is a laboratory scientist competent or safe? To do this, we need to consider what the sorts of skills are that we need to make that sort of decision. What sort of skills does an effective medical educator have to have? What sort of skills does a qualified laboratory scientist have to have? What sort of skills does a competent and safe practitioner have to have? For many disciplines, there are lists of these competencies that define whether someone can, say, join a register of qualified professionals. These lists are the basis for designing our exam. For most programs of education, there are lists of learning outcomes, definitions of what a learner should be able to do in order to be eligible for an award, whether it's medicine, laboratory science, teaching, or whatever. Similar lists exist for the completion of a particular level within an overall program of study. For example, is someone now appropriately qualified, have they demonstrated the learning to transition from year 1 of nursing school into year 2, or year 1 of pharmacy into year 2? The observed structured exam is a way of determining whether a learner meets those outcomes. This type of exam is largely focused on those outcomes that are more practical and applied, as opposed to, say, academic writing. This is also where the assessment design principle of authenticity comes in. Authenticity essentially means, does the assessment model what would be expected in the real world, in the world of work? Most of the things that we want graduates to be able to do in the real world are practical. And so designing an exam like the one we're talking about here is a very much more authentic way of determining whether a learner has demonstrated the skills that they need to be able to practice in the real world, compared to, say, writing essays or answering multiple choice questions. It's important to keep this authenticity in mind when we're designing the overall construct to be assessed in an observed and structured exam. It can be tempting to design the exam around what can be examined rather than really the other way around. One way to ensure authenticity or to improve authenticity is to get external stakeholder input into the construct that's being assessed in the exam. For example, if it's a clinical exam, getting patients, as well as qualified practitioners to input into the design of the exam. The same can be true when we're designing exams for the competency of laboratory scientists and educators. For example, if we're trying to work out whether somebody is an effective practical teacher, get some learners involved in designing what that exam might look like. The types of assessments that we use then examine learners' performance on a range of different tasks. For example, in healthcare, you might assess the ability of a learner to undertake practical examinations, communication skills, procedural skills like measuring blood pressure, plus diagnosis and management activity. The nature of the stations should reflect the overall construct being measured. So what range of skills should be demonstrated by, say, a graduate in healthcare teaching or science, or a Year 2 student progressing to Year 3? Each of the individual assessments that's shown here we would call a station, and the overall exam comprises of multiple stations. The precise number of stations needed and the length of each station will depend on the construct being tested. In our examples here, we're going to consider a design that includes 12 different stations. Each station will take between, say, 8 and 16 minutes to complete. Generally, the higher the level of learning that you're assessing, or the higher the stakes, the more stations are needed. This is a basic aspect of the reliability of the exam. Very simply, the more measurements you take, the more data you have, the more likely it is that you can make a reliable estimate of the performance of the learner in ways that are consistent and defensible. Each station is marked by a different examiner, and sometimes by more than one examiner. Each examiner has to be trained, and the marking has to be consistent between them. No matter how many stations we have, it is unlikely that we're going to be able to cover every single learning outcome for the program that we're examining. And so we need to make sure that we have an appropriate sample across relevant domains of the course. For example, in a medicine OSCE, we might want to make sure that we have an appropriate range of tasks being assessed. So maybe 3 of the stations would be assessing procedural skills like taking blood pressure. 3 of them might be assessing communication skills like taking a history or breaking bad news. 4 of them might assess patient examination skills like cerebellar function. And then 2 of them might assess prescribing and management. You then want to make sure that the appropriate range of disciplines are covered. For example, in medicine, you might want to make sure that you cover pediatrics, orthopedics, GI, neuro, cardiac, respiratory, and so on. The combination then of the skills and the domains in which they're being assessed is called the blueprint. We can represent this very simply here with a list of the key domains versus the key skills, and by selecting an appropriate combination of these skills and domains. We can't measure communication skills in every one of the disciplines, and we can't measure every one of the disciplines in communication and procedure and examination and prescribing. So we create the blueprint, making sure then that overall our exam covers a sufficient range of the curriculum to be confident that the overall construct is being covered. The map is the blueprint, and again, it can be used in disciplines besides medicine. For example, if we were assessing an academic neuroscience course, then we might want our learners to develop practical skills in laboratory techniques, data analysis, neuroimaging, and communicating science to a lay audience. And we might want to do them across multiple academic domains like anatomy, pharmacology, EEG, systems neuroscience, neurogenetics, and so on. Again, we can construct a blueprint to ensure that we have a reasonable sample of practical skills that a neuroscience scientist should have in a reasonable range of domains that's covered in the academic neuroscience curriculum. Okay, so back to our 12 stations. Now let's consider briefly how we design an individual station. Each station has its own mark scheme or rubric, and they tend to look something like this. You have the overall skill being tested in the station. This is known as the construct, but for the individual station rather than for the overall exam. What is it that the candidate should be able to do in the station? This construct is then broken down into individual items, which together form a checklist. The design of a checklist for an individual OSCE station is a skill all of its own, and we've covered this in a different video. In that video, we've also concluded some aspect of ensuring the inclusivity and equitability of the stations, and so the exam overall. Each candidate is scored against all the items on the checklist, and then the overall score is calculated. There is often also a global rating on the checklist, where the examiner is asked to make a global rating of whether the candidate in the assessment was an excellent pass, or were they just good, or were they just a pass, were they borderline, or were they a fail. This is an important consideration of the overall scoring of the OSCE exam, i.e. where all of the stations are added together. Traditional academic assessments, there is normally simply a set pass mark. For example, the learner has to achieve 40 or 50%. Then the individual examiner has crafted the content of the individual station such that the learner who scores 40 or 50% would be considered a pass. This is standard for many academic disciplines, and many students may then be scored exceptionally high or possibly lower depending upon how well they have done. So a student who scores 80% might be demonstrating an outstanding level of performance. This is often sufficient for traditional academic disciplines, but many of the contexts in which we would use these types of exams are focused more on whether or not someone is safe or competent rather than necessarily how good they are at a task. In these cases, the focus tends to be more on the specific definition and threshold between safe and competent or not. When we do this, there is often some more sophisticated analysis that is undertaken to determine what the pass mark is. Often that involves allowing a large group of students to undertake the exam and then using this global rating described on the previous slide to identify the pass mark for individual stations and thus the pass mark for the overall exam. This involves applying some statistical analysis like borderline regression to identify the cut score or pass mark. Identifying a pass mark using these methods is also the subject of a separate video because it doesn't apply to all disciplines equally and it is quite a complicated task to get right. In some disciplines like medicine and health professions, it's very, very important to get right. Nevertheless, it is quite useful to have a global rating no matter what context you are applying these observed structured exams in. For example, in an academic exam like in a neuroscience exam or a STEM exam or a teaching exam, having a global rating where an examiner is asked to make an overall judgment can be useful. Was this person able overall to do the task or not? This helps the examiner shape their feedback and their scoring of the station and is also useful for the learner themselves to identify how they have performed overall. How did I get on and how do the different components of the checklist contribute to whether I passed or not? Now let's consider some aspects of the student experience of undertaking one of these observed structured exams. 12 stations, each of which might last 10 to 15 minutes each. This is quite a heavy academic burden for the learners to experience. So it's very common to put rest stations. Rest stations are put in between examination stations and they allow the students to simply have a rest, to give their mind a rest, to have a drink, to have a break, to have a pause and think about where they might be going in the future stations. So in a 12-station observed structured exam, you might put 2 of these in and have only 10 actual examination stations, or you might add 2, so there are 14 stations overall, 2 of which are rest stations. There is another element related to the student experience that also relates to a very important assessment design principle, which is the security of the assessment. If you have students going through 12 different stations, each taking 10 or more minutes, plus time in between for rest and for setup, then if you have a reasonable sized cohort, the chances are you'll have to run the exam more than once. This can mean that the students who go first will know what was on the exam and then could give this information to the next set of students who haven't yet taken the exam. This might give an unfair advantage to the students who do the exam later on. What do you do about this? Cheating and misconduct in these types of observed structured exams is quite rare. It's quite hard to cheat in these types of exams because they are in person and they are observed and they are very practical. However, when misconduct does occur, almost always the most common form of misconduct is communication of stations between students who are sitting the same exam. Students who have done it, telling the students who have not yet done it what's coming up. There are many schools of thought about how to address this issue. One common approach is to have what's called holding rooms. So, for example, the first group of students might have to be held in a room once they have finished the exam so that they do not communicate with the next set of students. This requires them to hand in their phones and other devices to prevent them from communicating with those next set of students. This approach can work where you only have 2 groups, but any more than that and it becomes very tricky, especially if the exam runs over multiple days. You can't hold students indefinitely or overnight in these sorts of holding rooms. You can simply ask students not to communicate with each other, but there is an abundance of research to show that simply asking students not to communicate simply does not work. This sort of approach almost always results in students taking later versions of the exam getting higher scores than the students who took the exam earlier on. It also potentially puts students in a difficult position if they are asked what was on the exam by a student who's coming later. Overall, this type of holding room approach tends to result in a fairly poor student experience. Being held in a room without your device once you've finished an exam is a pretty miserable thing to do, particularly if they are held for an extended period of time, and then the pressure to give information to other students is also a pretty miserable thing to have to be put through. Most students appreciate the need for this sort of holding room approach, but it doesn't mean they have a great time while doing it. Another approach to this is to make slightly different versions of the same exam. Across multiple sittings, for example, the 12 stations that happen on the morning of the first day might then be subtly tweaked for the exam in the afternoon and then the following day and so on. This is where the importance of blueprinting comes in. As long as the overall blueprint is maintained so that the curriculum is appropriately covered in each sitting of the exam, then it's probably okay to rotate the individual nature of the stations. So have communication skills in neuro in one version of the exam and procedural skills in respiration for another version of the exam and then flip those around. This can create some face validity concerns where students feel like they've been assessed on different things in different sittings of the exams, but it is a defensible approach as long as the blueprinting has been done appropriately, and lots of students will take this type of different versions of the same exam versus having to sit in a holding room. A final way to do this is simply to tell the students all of the stations that are going to come up, or to give them a list of, say, 40, 50 or more stations and say, your exam is going to be comprised of 12 to 16 stations from this longer list. There isn't necessarily a right or wrong answer to these sorts of security issues, and we do have to balance the security and validity of the assessment against the overall student or learner experience. Finally, there is the question of resource. If you have 12 individual stations, each of which has to have an examiner, some have patients or laboratory equipment, each of which has to take place in a different room, the examiners have to be trained, fed and watered, and so do the students, the resources can add up very quickly. These types of exams are not easy to do. They're also not cheap to do. They require a lot of planning, a lot of organization, and then this adds additional costs. There's no real way around this, but it's worth noting that if you are considering putting on one of these exams versus, say, undertaking a traditional written assessment like an essay, it's worth considering what the total cost is of administering both types of assessment. Lots of the costs of traditional assessments like essays can be hidden. Marking takes a really long time. Software costs can add up very quickly. Map out what the costs are for the two different types of assessment when you're considering a switch between one and the other. Decisions about resource and costs often have to be taken at a higher level than us humble individual educators, but it is important to consider them when we're trying to design one of these types of assessments. Okay, that's it for the whistle-stop tour and introduction to observed and structured exams to assess practical and clinical skills across higher education. If you've got any questions, here's my email address and the rest of the videos that I refer to here on the YouTube channel Newton's Neuroscience. All right, bye-bye, and I'll see you in another video.